Welcome to this Tuesday's discussion on adjusting through transitions and ways to enhance coping. My name is Ashley Anderson, registered dietitian, personal trainer, and owner of Move Fully Nourished, where we specialize in helping active adults heal their body using a holistic approach, using the power of food and movement as medicine. Joining me today, we have two very special guests that are going to bring a whole nother dynamic to this conversation we're having today, and a little bit of background and introductions on them. We have Tiffany Casper. She is a licensed clinical social worker who specializes in anxiety, emotional and behavioral challenges, mood disorders, trauma, self-esteem, ADHD, eating disorders, substance abuse, chronic illness and pain, divorce, and other life challenges. Quite the mouthful. Welcome, Tiffany. Thank you so much for being here and joining us. And then we also have Emily. Emily is a licensed professional counselor. Her expertise is working with individuals struggling with substance abuse and just mood disorders, as well as depression, anxiety, eating disorders, process addictions, and gambling, grief, and trauma. Welcome, Emily. Thanks again so much. So let's dive into our topic today on adjusting through transitions and ways we can enhance coping. Our world, we know, our country, our communities, and our families have been through quite a lot in the last year. And I'm sure you ladies have been really busy with everything that we've had going on. And half those challenges and really looking at the last year and a half have really stemmed from COVID-19. And today we want to lean into really the expertise of these two ladies so that we can help guide our audience today on concrete steps and ways to take action through these adjustments. And first, Emily, I'd love if you could just tell us a little bit more on some of the adjustments that you've seen your clients go through over the last year and a half.
Mm-hmm. Well, like you mentioned with COVID, it has definitely been a lot going on for a lot of people. Some of the COVID-specific changes will be like changes in your work environments. You know, maybe you were working in person and then you switched to working from home, and then it went back to in person or some hybrid of the two. Grief and loss of loved ones that, you know, maybe passed due to COVID, grief and loss of our normalcy. You know, life as we knew it isn't how it is right now, and that can be really challenging. There's a lot of changes in societal norms and policies like mask mandates. You know, all these things they can be really emotionally overwhelming, and they can just be a lot and cause a lot of suffering, you know, at the moment.
Absolutely. And looking at all of those things that we've transitioned with over the last year and a half, like you're saying, adjusting with work and having to wear masks and not having to wear masks, and just trying to figure out how to adjust to the new norms. When we find ourselves really suffering through that pain, what are some of those options that we can help our viewers today really work through and strategies that they can use?
Yeah, so I wanted to talk about a concept that comes from DBT, which is dialectical behavioral therapy, and it's called radical acceptance. But according to DBT, when we find ourselves in emotional pain or emotional suffering, you know, like how COVID has done to us, we have a couple options. The first option when we find ourselves suffering is to do nothing and just stay in the suffering. You know, and it's important to remember that not taking actions to improve our situation is an action in ourselves. Not the best option, don't really recommend it, but sometimes we do that as people. We just stay stuck, don't do anything, stay miserable. The second thing we can do is sometimes we have the ability to change the situation that is causing us pain. You know, sometimes we can control our actions and control the situation to kind of improve it. An example of this would be ending a toxic relationship or leaving a dead-end job that you're not getting any joy out of. But in order to change the situation, it requires a realistic appraisal of what are our options, and they need to be grounded in our values. You know, we have to ask ourselves, what am I willing to do to end the suffering and to better my situation? Another option, if we can't change the situation, much like with COVID, we can't control what's going on right now, we can try to control how we see the situation. So, you know, one of the things we can ask is there an upside, or is there a silver lining to whatever's going on? Can I find meaning from this pain and from the suffering that I'm experiencing? Is this a terrible situation that's just totally awful, or is this a situation that's going to teach me strength and patience and resilience and help me out in the future when I'm going through something similar? And then the fourth option, if we don't want to do nothing, we can't change the situation, and it's really hard to change our mindset, is to practice acceptance. So acceptance is giving up the struggle of the things we cannot control. It's the ability to accept our situations that are outside of our control without judging them, which in turn will decrease the suffering caused by them. The things we cannot control are people, the world, the past, physical sensations, thoughts that pop into our head, COVID, policies. Really, there's a lot of things that we just can't control. What we can control is our actions and behaviors in the present moment and then moving forward. So I mentioned radical acceptance. That's the term used for when we need to accept these really big things that are difficult. It's easier to accept that I don't have milk for my cereal in the morning than it is to accept loss and trauma that I've experienced maybe due to COVID. Now, one thing to point out is that acceptance doesn't mean that I like it. It doesn't mean that I approve of it or forgive it. It doesn't mean that I'm okay with what happened or that I'll allow it to happen again. An example of when radical acceptance can be our best option is, let's say someone I love did something really bad to me and hurt me a lot. Acceptance in this situation would be telling myself that I can't change what happened. I don't have to like what happened. I don't have to forgive the other person to practice acceptance. Acceptance is really for me and my own well-being. It's used to decrease my suffering and help me move past, the pain that I'm experiencing right now.
I love how Emily, I love how you said acceptance does not mean that I like it, that I approve it, that I forgive it, that I'm okay with it, that I condone it, or that I allowed it to happen. And I feel like this is a concept that I often run into even with our one-on-one clients, in terms of trying to navigate through the shifts. And this may be where we touch a little bit too on pivoting mindset and trying to make those adjustments, but it isn't necessarily all of a sudden making everything, roses and daisies and, flowers galore, and it's not putting sunshine on it. It's trying to address it in a way without judgment. And I think that the way that you phrase that is going to be an important concept for people to understand, because that's going to help them take that first step in making that shift or transition mentally. So I think that's really great. And practicing this acceptance and these coping mechanisms is going to be another great tool. And I'd love, for you to elaborate on that as well.
Absolutely. In acceptance, it sounds easy to do, like, oh, just accept it. But in reality, this is probably one of the hardest coping skills to use. And it does take a lot of practice to be able to get to a point where you can accept the past. So there are a few ways that we can start working on acceptance. One of those is through what I call coping statements. So they're just things that we can tell ourselves to help us, get out of the past and get out of that suffering that we're living in. An example could be, saying, I can't change what has already happened, or it's no use fighting the past. Another coping statement I like is saying, this moment is the result of hundreds of other decisions. And this one can be really helpful for those situations where we're thinking, well, if only I would have done this, things would be differently. Or if this had happened, then I wouldn't be where I am now. Reminding ourselves that this moment is the result of hundreds of other decisions can help remind us that, there's a lot at play here. There wasn't one thing we could do differently. And, it's okay. The past is in the past. Another coping statement I like is just saying, I can't control others. I can only control myself. Help remind us that I'm only in control of my own actions. I can't control what anyone around me is doing. Another way to practice acceptance is to do it with those little things. So this is what we call everyday acceptance. So like I said, it's easy to accept that there's no milk for my breakfast cereal. That's a tiny annoyance that we experience. And if I can practice accepting it, I can adopt that accepting mindset to make it easier to do those bigger things. Other examples of when to use everyday acceptance is like, I have to wait in line at the DMV and it's taking forever and I don't want to be here. Or maybe my partner forgot to take the trash out again and the kitchen smells like garbage and I've reminded them not to do this. That's a frustrating situation. It causes us pain, but if we can practice acceptance, it can make it a lot easier. Other examples would be like my friend cancels plans last minute that I was looking forward to, or maybe I'm stuck in traffic. And like I said, practicing this acceptance with smaller things help us be better able to use radical acceptance for those really big things that we see in the future.
Yeah, Emily, this is so powerful. And this really reminds me of a technique that we use with our one-on-one nutrition clients too, about the idea of building your resilience. And I often tell our clients to envision their stress like a brand new rubber band. In the beginning, it's really difficult to stretch and flex that band. But over time, as we practice that acceptance and continue to stretch that band of resilience, then we are able to, and resilience meaning, the band itself is representing stress, becomes more flexible and we're able to stretch it further before that snap. And I think it's really important to discuss the different types of coping strategies that we see with our one-on-one clients. Tiffany, I'd love to hear a little bit more about what your experience has been like working in your office and helping people cope.
I mean, there's certainly a lot of talk about coping mechanisms, both healthy and unhealthy. So when we think of unhealthy coping mechanisms, we're looking at, drug or alcohol use, overeating. I'm sure you see that a lot, Ashley. Procrastination, maybe even sleeping too much or too little, withdrawing from people, even self-harm. Healthier, coping mechanisms might be exercise, which I know that's something you really promote, Ashley. Talking about your problem, that's what we're here for as therapists, to help you work through things. Healthy eating, relaxation techniques. So deep breathing is a good one that I can think of. And using social support, even using problem-solving techniques.
Absolutely. And all of these techniques, or I should say, first, the different ways that you're describing those healthy coping strategies and following them up with really now, how do we actually take care of ourselves and really practice the importance of self-care within that?
So my clients would tell you that I probably talk about self-care until I am blue in the face. Like, I'll get eye rolls and, Tiffany, like, when am I supposed to even have time to practice self-care? Well, if you're telling me that, that tells me that is when you need self-care the most. Like, great tool for when you are at a low, or even when you're doing well, to maintain where you're at. It is so critical to have in place. Now, a lot of people probably think self-care is bubble baths, and I will tell you, it is not just bubble baths. It could be broken down into, different categories: physical, psychological, social, spiritual, professional. So, we think physical self-care, a lot of that is what you're doing with Ashley, I'm sure. Eating healthier foods, making sure you're taking care of your hygiene, exercising, paying attention to, the clothing that you choose. Like, how do you feel it fits? Making sure you're eating regularly, making sure you're hydrating, participating in fun activities. So that's really what physical self-care is all about. I'm sure you're getting a lot of that from Ashley. It could be psychological though too, so taking off time from work, using that PTO to take vacations, to spend time with family, participating in hobbies. Work isn't your sole identity. You should have things outside of there. Getting away from distractions. I was just talking with Ashley about this weekend. My husband and I, we went camping, and it was great to just unplug from social media. So maybe that's what you need. Learning new things, expressing your feelings in a healthy way. So maybe you're using art or journaling as an example. Making time for those vacations, as we had said. Finding reasons to laugh. Oh my God, laughter, so amazing. We did that here in our morning meeting yesterday. Isn't that right, Emily?
Absolutely.
And so then self-care could be social as well. So spending time with people that you like to be with. I had a client who made a phone tree and called friends and family members, when we were in lockdown with COVID. planning those Zoom chats, talking to your friends, even if you don't feel comfortable being physically in the same room. There are ways that you could still be social during COVID. I would say self-care could be spiritual too. And that doesn't mean like, oh, I have to go to church. That could be spending time in nature. It could be meditation. Maybe prayer is your thing. Setting time aside for that. And then self-care is professional as well. So saying no to certain things, not taking on too much, but also learning new things in the workplace and taking that time to build upon relationships with your coworkers, finding some sort of balance between work and the personal life so that you don't burn out.
Absolutely, Tiffany, I love this. And I often too refer to it as almost like putting pennies in your piggy bank of self-care. It's important not to rely on self-care only in the moments when we're feeling most stressed or when we feel like we need it most, but really to create that savings account so that we can continue to build that resilience when something is presented and when we need it most, to really have those tools in our toolbox to fall back on in those moments. But oftentimes I hear our clients saying, I really feel stuck or I feel paralyzed and I'm not able to take that action, or I'm struggling with trying to make those shifts. How can we pivot, more in the opposite direction?
That's a great question. That's something that as humans we struggle with a lot. A coping skill for that I would recommend is called opposite action to emotion. So it's used to help get unstuck from these ineffective behaviors that arise from certain emotional states. We get stuck in difficult emotional states partly due to mood congruent behaviors. We fall into these behavior patterns that really work to keep these difficult emotions around. For example, when we're feeling depressed, we tend to isolate, be inactive, ruminate on negative thoughts, and so forth, which will all just work to increase our depression and keep it hanging around. So the goal for opposite action to emotion is first to increase our awareness and insight into our emotions, identify the opposite end of the spectrum that we want to be on, and then engage in actions to get unstuck. For example, let's say I notice I'm feeling anxious, my heart is racing, I'm engaging in mood congruent behaviors such as isolating, avoiding others, I'm not being productive. After I identify that the emotion I'm feeling is anxiety, I can identify the opposite emotion to anxiety. Maybe for me in this moment would be calmness or serenity. So I'm feeling anxious. I would rather feel calm. So I'm going to engage in behaviors that will promote calmness. For me, this might be going for a walk, practicing breathing exercises, maybe petting my dog. The goal is to focus on the behaviors that promote calmness to hopefully change my emotion farther from anxious and closer to calmness. Another example, let's say I'm engaging in behaviors such as staying in bed, I'm having negative thoughts, feeling a lot of worthlessness. I can identify this emotion as depression, and I can identify the opposite of that might be feeling hopeful. I can then engage in activities that will promote hopefulness and in turn decrease the depression that I'm feeling. Behaviors that promote hopefulness for me may be volunteering or spending time with children who are, the young generation, or maybe even reading news articles about people who have been helping others in times of crisis. COVID's a great example. There's so much negative news around, but there's also a lot of good going on. There's a lot of people who have been really dedicated to helping others, serving others, working through the whole pandemic just to be of service and help others do better. And focusing on those types of news articles can make me feel a lot more hopeful and a lot less depressed.
Absolutely, Emily, this is really fantastic and something that I'm now going to use with our clients, because oftentimes when our clients feel stuck, they can only think in a very narrow focus, right? Like what they are experiencing is so real that it's very difficult for them to think of that opposing action or that opposite emotion. But I love how you use the pivot strategy to think in opposites to really get unstuck and then create that action. With our one-on-one nutrition clients, we often discuss, ways to cope and transitions and adjustments in healthy ways that don't involve abuse or misuse of foods or beverages. because there are long-term effects to that usually lead people to seek out our help, and that's when they start working with us. But we want to create that awareness around their eating habits and how they aren't serving their bodies to reach their optimal goals. And I'd love to dive a little bit deeper really into some of these strategies that you both use with individuals who use food or alcohol to cope with their stress.
Well, I like to think a lot about the long-term effects when it comes to overeating and, how we tackle that piece. I think an important place to start is looking at the fact that overeating in the long term can increase our risk for the development of different diseases. So we think of, heart disease, think of obesity, diabetes, stroke. Can you think of anything else, Ashley?
Yeah, and even just going back to the emotional, the emotional triggers that are tied with that too. When we start to disassociate from our bodies or start to feel like things are changing, or we're starting to see the impact of how it's impacting our health, we often start to have an identity crisis. I am now this unhealthy person. I now can no longer move my body as efficiently or effectively as I used to. I now can't run after my grandchildren. So there's definitely those long-term impacts, and yes, overall affecting our health for the long term.
I mean, in addition to that increased risk for developing disease, we think about, overeating can disrupt hunger regulation. So eating foods high in inflammatory or processed fats, salt, or sugar, that releases this feel-good hormone like dopamine, and then that activates the pleasure centers in your brain. So you could see how food could be, interacting with the brain. It could be addictive. It's comforting. I want to grab for that food. Over time, our body can associate these pleasure sensations with certain foods, which tend to be high in inflammatory fats and calories. This process may eventually override hunger regulation, encouraging you to eat for pleasure rather than hunger. Disruption of these hormones may trigger a perpetual cycle of overeating. Now, in addition to the disruption of hunger regulation, there can be an impact on brain function. So, this could impact, our ability to process, and it could have an impact on our memory as well. People may even feel sluggish or fatigued because of a drop in blood sugar after overeating. So you really have to pay attention to how your body and mind are both feeling. Really all goes hand in hand.
Absolutely. And we see this a lot with our new clients who have not yet established that healthy relationship with food, who are chronic dieters and are in constant dissatisfaction with the state of their body. And we also, have several people who use alcohol to cope with their stressors, and in a very numbing way that doesn't lead to progress or progression, but often leads them numb or exactly stuck where they are. So, but shedding light on some of their habits often shocks these individuals. And I know, Emily, this is kind of your specialty, your area of specialty. So in terms of, what you see with alcohol, tell us a little bit more about like that unhealthy and healthy relationship too.
Yeah, so alcohol use, I feel like, has increased a lot for a lot of people, over the past year and a half or however long it's been, because it is effective in the sense that it helps numb our emotions that we're feeling. Long-term effects, though, it has a lot of negative impacts on our life. Moderate drinking is generally defined as 0 to 1 drinks a day, no more than 7 drinks a day. No more than 7 drinks per week. Which is still, quite a bit and can greatly impact our body's ability to detoxify all the chemicals we're exposed to in our modern world. But that is kind of generally how they define moderate drinking. Now, high-risk drinking would be more than that. It's generally defined as more than 7 drinks a week for women, or more than 14 drinks a week for men. So some of the long-term effects of alcohol use, it's really similar to what Tiffany was saying with overeating. So I don't want to overlap too much, but long-term risk of using a lot of alcohol can lead to certain cancers, pancreatitis, heart muscle damage, stroke, high blood pressure, liver disease, accidental injury or serious death. For those without an addiction, alcohol can be moderated and it can be a social activity. We can use it, for fun and to relax. Alcohol becomes problematic when we go from drinking socially to drinking as a coping mechanism, drinking to numb or escape, or drinking to get drunk. So my advice, if you think your alcohol use might be increasing recently due to stress, and you think it might be at risk to become problematic for you, the first thing you can do is just try to abstain from alcohol for 30 days and see how that goes. If you're trying to quit drinking alcohol, but you keep going back to it, we can look at if alcohol is becoming a crutch for you. You can also try to replace the habit of drinking with a healthy coping mechanisms, such as using opposite action to emotion, or using some of the self-care ideas that Tiffany talked about earlier.
And even in this scenario too, Emily, when you were discussing before about basically identifying what your emotions are and what you're experiencing, and then the other emotions you want to have, instead of going down that numbing path or finding it as a crutch and using alcohol, it leads us back. What was that coping strategy, or what you mentioned before is where we're talking about pivoting? What was the term you used?
Opposite action to emotions. We want to focus on the actions we can control that will promote the emotion opposite of what we're feeling.
Yes. So opposite of what maybe is leading you to drink to excess, and identifying it first in that moment, recognizing there's an issue really is the first step in making a change and seeking help. And that's where we often have that conversation with, I'm sure, people that come in to see you guys and people that are coming to us as well. But sometimes when we have a nutrition client that recognizes there's an issue, or they have been misusing food or alcohol for years, at times they can't really articulate exactly what they want or how they feel and what success looks like for them on their journey. And this is something we often talk about as the fear of success, the fear of taking shape into something different, identifying yourself in a different light and changing identities. Can you guys highlight, maybe why would someone feel afraid or fearful of reaching their health goals or succeeding or taking control of their life?
Ashley, you presented that whole idea of fear of success to me last week. And I'm like, wait, fear of success, not fear of failure. I had to take a step back and actually think about it some. But, I wanted to delve into okay, well, why would somebody have that fear of success? So, through further reflection, I came up with some bullet points. So we could be avoiding it because we are avoiding backlash or a negative reaction. That negative reaction can be so uncomfortable that we just want to avoid success altogether. We might be wondering, can we live up to others' expectations? What if they don't think we deserve this? What if my friend thinks I don't deserve the A that I got on this paper, even though I worked really hard for it? And we could also think about the fear of success going back to our childhood. So if as a child you were belittled for success or scolded, you learn to avoid success rather than face negativity altogether. And so then you're probably like, okay, well, now what? How do I even begin to overcome this fear? So we would be exploring the origin of it. Like, where does it even come from? What are your past experiences with success? Think about earlier successes and what happened as a result. So thinking back to, childhood, college, whenever in your life, we would want to pay attention to, well, how does that manifest? Like, how does that fear show itself? What are some ways you've been sabotaging your path to success? And if you identify the behaviors, you can begin to counteract them. Now, in addition to those 2 points, we want to visualize success. Think about, what does it mean to you? what are the potential positives and negatives? Imagine achieving that goal, what may happen as a result, and different ways you might deal with it. Think about how it's going to feel to achieve that goal. And then another way of overcoming the fear of success, we want to look at managing stress and anxiety. So stress and anxiety may be contributing to these fears that we're having, and practicing self-care and any of those healthy coping mechanisms, which we discussed earlier, can be helpful in managing these feelings.
Absolutely. I mean, this discussion today, ladies, and just looking at the takeaways from all the different topics, from transitioning and adjusting to coping mechanisms, to identifying the difference between healthy and unhealthy coping styles and what that looks like, and the method of pivoting your thoughts and adjusting what the current state is that you're in right now, and where you want to be and how you want to feel. I feel like there were so many amazing things that you can take away from today, and we'd love to hear from you. If you made it to the end of our discussion today, we want to know your thoughts on, can you relate to any of these topics that we talked about? Are you realizing that you have been stuck in inaction and you need help pivoting and moving forward towards that healthier version of you? You can find these two lovely ladies over at Consider Yourself Counseling, located in St. Charles, Illinois, as they work with their clients in person as well as virtually, so from anywhere. And I definitely appreciate your insight in this topic today, ladies. Look forward to future collaborations with your team and outstanding counselors. Thank you so much for both being here. Really appreciate it.
Thank you. It was a pleasure.
Okay, well, everybody have a great rest of your day. And don't forget to share with us your feedback and what you'd like to see more of in the future. Have a great day.